In this video, we're going to cover the Landau Reflex versus the pubic bone strike, and a simple at-home exercise that you can do to improve the movement.
The Landau Reflex, again, the pubic bone strike should be happening in about 4.5 months. It's not just looking at the pose, but understanding what it is to get you one step closer to helping your child the most efficient way possible. And that's what we're about here.
Welcome to Movement Lesson. Find our links in the description below.
So understanding a milestone is also understanding what some people look at as reflexes. Now the Landau reflex is really the pubic bone strike that I refer to. I want to show you what the difference is. Now the Landau presents a reflex. It's when the baby can supposedly tighten their back to a point and get in this, or what we say is a sphinx pose. Right? This is really not what's happening. And the reasons why, the warnings you're looking at is you're expecting your baby to push up. It's not how it works. Your baby, especially if they have midline complications, can also show up here because they're starting to really back arch. And another big one that you're looking at with vision is it's really hard for your child to sort of look up. So they're really cocking their head back to a point where they can see up instead of look up. Does that make sense? So instead of looking up with their eyes, they're moving their head to move their eyes, right? So you want to know what the difference is. But when the head comes back like this, look at my baby in midline, right? These are the complications right there. When the head comes back, there's no midline crossing. You should see this. Do you see how the head and the upper thorax are slowly learning to work? And this is a pre-crawl. This is why too babies should get the tummy time. But this, there's no midline crossing. What really is happening is your baby is also tummy time. They should be doing airplane at this point, right? And they're here and doing airplane. They should be able to move around. They're surfing off their pubic bone. They're moving around this way. It is not this. It's not a perpendicular, right? And then what happens is that they'll actually start to, what you might think is a plank, it really isn't, but they're meant to strike the pubic bone, right? That pubic bone strike is so important because that's also what brings the tongue out and the articulation there. So again, too, if you're not seeing the raspberry at this point, when they're doing this, if you're not seeing that the tongue protrudes past the lips now because of the pubic bone strike. If it's just a back arch or a lack of midline, the tongue's still not going to come out. So there's a way of helping your child, right? But there's many ways of helping your child. We want right now the most efficient way because you don't have time to lose. Thanks.
Ensuring a midline crossing along the spine, use a gentle touch with rotation. Transfer the weight from head to pelvis and back again. Use that same rotation to transfer the weight from shoulder to shoulder. Practice this exercise daily until the movement feels easy and fluid.